So I would like to welcome our speakers for the panel for today. I think they'll all bring a very interesting perspective from the work that they've done using AI. First is Dr. Olagoke, who is an assistant professor in population health at KU and the director of the Health Communication Solutions Lab. She leads the creation of AI-enabled tools that are designed to improve patient education and advance precision health communication. Our second speaker is Dr. Fast, who practices full spectrum family medicine and is now a physician owner in a private group practice. He participates in outpatient care, inpatient medicine, nursing home rounds, and a variety of office-based procedures. And so someone that has some experience using AI in the entire realm and gamut of clinical practice. He's also a president or past president of Kansas Medical Society. And then last, we have Dr. Lindsey Jarrett, who is a social scientist and is currently the vice president of ethical AI services at the Center for Practical Bioethics, where she leads work on ethical decision-making in technology and its impact on healthcare organizations and the communities they serve. All of these speakers are extremely accomplished and thus have much longer biographies, which are available on the website, but that at least gives you a thumbnail sketch of what it is that they're doing with AI. So first we'll have Dr. Olagoke talk with us about how patients are using AI. And then she and Dr. Fast will also talk about how then clinicians are using AI to communicate with their patients. So we, I think, can have a better picture of how AI is influencing the patient-clinician relationship from both sides of that relationship. So Dr. Olagoke, I will turn it over to you.
Thanks a lot, Appleton. Yeah, can we have it full screen? Yeah, good afternoon, everybody. Today I'll be talking more about how patients are using AI, and we probably, we are patients, and we probably can tell that probably have been using it in different ways. Sometimes I go to my physician, I'm like, I hope you don't mind. I already asked AI some questions before coming, so um, definitely I see anecdotally that there is a great use for it. A little bit about my AI journey. My background is in public health, specifically in health communication. But then because the work that I do focus on using technology-based type of communication to improve access to health information, I tend to work with quite a number of tools, which AI is also top on that list. So some of the things I'll be sharing today, you will see a bit of all of this in there using narrative health, using AI type of technology in creating those solutions. Next slide. So in simple term, AI simply means training computers to do what humans would normally do. And if we go by that definition, we could see that AI has been here with us for a long time. The big thing about is how can we make computers or computer models to mimic human intelligence and to do what they would normally do. And this dates far back to the 60s, where we've been having this occur. However, what we are seeing an explosion of is generative AI. Generative AI is an aspect of AI or artificial intelligence field, which allow us to speak in natural language to computers. So meaning that in the past, we have what we call rule-based AI, where if you think of your Alexa, where before you talk to it, you have to say, Alexa, before it comes on. If you want to process, think of your banking app. If you want a refund, you have to type refund. You can't say, I want my money back. You have to type refund. If you call your doctor's office, you have to say, for medication refill, say refill or press two. You have to press two. There are strong rule-based systems. But with generative AI, it allows you to use your natural language. You can say, give me back my money, and it understands it. You can talk to a computer system in your natural language. You can say, I want to request for my medicine. You don't have to say it in a particular way. You don't have to press a particular code. So think of the burden that takes off. Those are one of the unique things about generative AI and its explosion. Also, the fact that it allows to create new content in different fields. If you, in the previous, the rule-based system, if you type refund, there is a preset type of information you get if you type refund, or if you get refill my medication, there is a fixed kind of text you get or content. But right now with generative AI, you can create brand new, you know, you can prompt to get brand new type of information. So this is just wild and explosive. It mimics human creativity. It can get tasks done in natural language. I will see a bit of example of those. Next slide, please. So why patients use AI? I mean, we can almost imagine this. So some studies have shown that on average, it takes about 39 to 76 days for a patient to get available wait time, how long they have to wait to get an appointment for specialty care. And it takes on average about 14 days for primary care to secure an appointment. All of this, an average patient spends about 18 minutes in the doctor's office. So you wait for about 39 to 76 days or 14 days just to spend 18 minutes. If we look at the return on investment, even for that, um, it becomes glaring why a patient will probably go first to AI to get some of these things done. In addition to that, we've seen issues around access, wait time, limited appointment availability, also information accessibility, which is a large part of what I do. The fact that patients need information outside of clinic hours. They need something on demand. Yes, there is telemedicine, but you think of even patients with limited access to the internet or even telemedicine facility. You think of the rural community. These are all real challenges. Insurance is another big part. The fact that you want to get access to a provider and your insurance does not cover for that or does not allow you to be able to see that type of provider, and how patients struggle to navigate through those systems. Language and communication, that's also a big barrier. Someone like me, originally from Nigeria, and one of the conversations I've had with my physician, sometimes when they say, oh, stay off high cholesterol kind of food. And they give me examples, like, for example, stay off this food, this food. In my head, I'm thinking, those are not the food that I eat. Um, and then I'm thinking, if I say, should I stay off so and so food, which is what I eat culturally, my provider will probably say, I don't know. Like, I don't know that food, and I don't even know if that food qualifies, as something. So there's barrier at that level, cultural barrier, nuances. But right now there's AI where one of the tools that we're testing in my lab, it's like a nutritional thing powered by AI that lets you put your traditional food and it still analyzes it and gives an estimate of cholesterol and all of those that will come from the food. And you can even input how you make it. And then it can tell you, okay, if you're making it this way, if you make it this way. So all of those can give us insight into why patient will probably be adopting the use of AI because of these limitations that are traditionally humanly hard to do for different patients. Next slide, please. And I found this really interesting. This first one was taken in 2024. I imagine that the landscape has shifted so well. What patients think about AI in healthcare. But even as far back as 2024, I imagine that this would lean more towards comfort now. About 39% of patients say they are comfortable with using AI. And the second chart here says about 46% said they express support for using AI in mental health related issues. And about 38% say they think that AI would make better or much more significant contribution to health outcomes. So I imagine that would have gone probably in a more positive way, but there's limited study looking at trends, but this is one of the closest to show that there is some sort of upvote for AI use by patient. Next slide, please. So what type of patient, who is using AI? What the characteristics of the patient population? Common among younger patients. In a particular study, they did compare people younger than 65 versus 65 upwards, and definitely people younger than 65 were found to use it more. But even for those who do more subgroup analysis, the younger age group are leaning more, which the reason is not far-fetched, like easy navigation, access to technology. Also among caregivers, patients with stigmatized condition. This was also prominent in the literature of people who want to discuss things that they don't feel comfortable discussing with the provider, the fact that they can easily. So you could see those type of health situations where there could be more use, and also mental health is a big part of that with chatbots. Patients who feel unheard, rushed, or confused in the traditional systems. Amazingly, we also see more females than males. Um, we have already seen more studies that provide why this is so, but on several occasions, even the recent peer research, they also report that more females are using AI for health-related issues than males. Also, religiosity play a role, which I found interesting on how acceptance of AI correlates with religious beliefs. So that could also be something else to explore along that line. More white than black. Political views also matters. And there's limited study on rural urban comparison. The few that we have, this show that people in urban areas are more likely. However, more recently, this was shared in one of our meetings where I haven't seen the study, but someone was making reference to a study on how there is, in terms of differential rise, there is higher difference pre and post in the proportion of rural users that are compared to urban. So if you look at it at the absolute number, it could show that maybe 76% of urban versus maybe 45%. But if you look at it in terms of the difference in the usage, then there is higher usage in the rural communities. And this is partly due to some of the reasons we shared, access to care, timeliness. So there is definitely an upward trend. Next slide, please. What are patients using AI for? I like to categorize as two types of use. The direct use, this is when a patient goes to maybe a chatbot and say, I want to use it for symptom checking. But there is also indirect use of AI where you're using AI, but you don't know you're using AI, or you're not consciously opting in to use it. However, in the direct usage, we have for symptom checking, preparing for doctor's visit, asking questions, mental health support, tracking nutrition. We did have a meeting this week with community health workers, and they were alluding to how they use this with some clients as well, especially in medication reminder, using it to create. One of the examples that they shared was how they use it to create how their clients would use their medicine. So, for example, you want to say, take this in the morning. So you use ChatGPT to design a logo of sunshine to show that that is morning. And then you're able to say afternoon, and then you create all of those graphics, and then you put the medication into it to make it easier for patients. So there's quite a wide range of use for patient, either directly or through the caregivers. Also, stigma-sensitive conditions, interpreting test results. We're seeing this a whole lot. And if you look, the image we have here is the image of the ChatGPT Health. It's currently not widely available. It's only available, you have to join the wait list. But a screenshot from it shows that they also have these categories of how patients can choose to use it. So they have, you can connect it with your medical report. You can use it in asking questions from your provider. Then it could, if you, it could give you that. Next slide, please. We've been seeing patients use AI, of course, as second opinion. So, because sometimes the wait time between maybe when you do your test and you get the result versus when the provider calls you to give explanation, like that wait time is getting filled up with AI, where people will just say, hey, I want to know. So we see a whole lot of test result and explanation. Here is also another use that we've seen, which is where topic specific chatbots. So for example, this is a menopause chatbot. We have the general purpose chatbot like your ChatGPT, but there's also a rise in the creation of topic specific chatbot, where this could be a chatbot for menopause, a chatbot on breastfeeding. This was created by our lab and evaluated. This is the evaluation scores where we created a chatbot where we trained it on the type of health information sources that are credible. And then we built it with that and evaluated with physicians. We had one OBGYN and then a nurse practitioner review the output of the chatbot. And that's another area where we've been seeing usage on topic-specific chatbot. Next slide, please. Also, there is indirect use where a patient is using AI without necessarily going into or prompting a tool directly. An example of this is the Google overview, Google AI overview. Right now, you go on your Google, you type in, you search for something, and then you know, it brings an AI summary even without you asking for it. I have two medical students in my research lab currently, and they're looking at Google overview and evaluation. Because a few studies have shown that a lot of patients don't go past Google overview now. Like once they type something into the chatbot, into Google search, and it brings that short overview, like that's all they read. So they are looking at the output from Google overview, just that blob, and then they're evaluating it to see how accurate is this and how well is patient using this. So 26% of users ended their session after viewing the overview. That's a whole lot. That means they just stop at that point of the overview, whatever the summary is. And there's a lot of ethical concern around that. Like, how does the model select what voice to amplify? Um, what are the metrics? How accurate is that? What happens? Who do we hold accountable? So, but that's another way patients are using AI and sometimes not intentionally because the feature just comes up. It just gives you AI summary. Um, Next slide, please. Okay. I think we are not sharing the sound. We may need to unshare and then share with sound because that's supposed to talk. I think the sound. Okay. But we can pause it for now. I'll let you know when to play. Thank you. So opportunities for AI in patient care for the use of AI. I'll just share a few of some of the projects that we're doing around patient education and patient communication with AI. There's a term that we've been using in my lab, which is a move towards precision health communication. What we mean by that is we don't want to do a one size fit all kind of health communication to patient. We want you to receive health information in the way that you like to receive health information. This is already happening in, outside of medicine where you type maybe you want to buy a car and then you keep seeing advert of cars, red cars, tailored for exactly what you're looking for, the type of car you're trying to get. So how about we have that for health communication where people can receive health information in a way that is tailored for them using hyperlocal landmarks. And we've done quite a number of projects on that. This that I'd like to highlight is we're building a character set for an African immigrant healthcare provider, and then we're able to who would teach like a character you think of like your maybe Mickey Mouse character. So the goal is for us to have this character on this episode, maybe she talks about blood pressure. The next episode, maybe she talks about physical activity or something. So we're building around a particular character. And then we have different of the character profile, the character sheets where we share with committee members to say, what do you think the character should look like of someone who will be doing this? So there's a lot of co-development with patient population happening where in the past, for us to do this, we probably will have to do an audition for real cast. But now with AI, we're able to build this type. The one with the tick is the one that people say, yes, this is what this character would look like. So I will just play like a 8 seconds of, yeah. Oh, okay. I don't know if people heard that because I didn't really hear it. Um, but she was saying today, let's talk about your blood pressure. But then she has the accent, which is what we really want to reflect. So right now, just towards that goal of precision health communication, what will it be like if patient can get it's hard for you to say, I want a physician who speak with my accent. Like that's just not too realistic. But with AI, we can be able to replicate that where we have characters that represent or avatars of physicians, and then they speak in the way and communicate in the way that the patient will be. The other project we're doing, which is highlighted here, is in We're working with Washington University on pediatric oncology in Uganda, where we're building a video library with AI. Um, one of this, one of the challenges they've had is treatment abandonment on pediatric oncology. So we're building a video library to address different topics on why, what is cancer and educating patients. They have just few social workers who traditionally do this, but then there's a lot of burnout. They don't have the time to keep repeating the information over and over again. So they want to translate the information that they give to patients into a video library. And we're building that with AI, and we're doing that here from the US without having to go there. Traditionally, we'll have to go set up the same, the cast and all of that, but now it's possible with AI. So that's another opportunity with patient education. Next slide, please. Okay, we may have to pause that. So, okay, I still don't hear the sound, but it's okay if I can just say what I say. Let's go back to where you have my image. So this right here is still towards patient communication. This is me speaking Spanish. I don't speak Spanish, but this is my AI twin. Trained with my image, my voice, and it speaks Spanish and provides education in Spanish. So this is another opportunity. You think of the different population that we have in the hospital and how we can, like, I don't have to even be awake for this to work, and I can AI can, like it's a powerful tool depending on the actor. Like you probably have seen deep fake videos of people using AI to say and do what it's not really saying. But then we can also take the reign on that, and we can begin to use it for good or for advancing um better health outcome. Like it doesn't have to stay in the hands of bad actors only. I have a colleague who does this more frequently. Like she has her AI avatar or her AI twin that educates on different topics. She's a nurse on in Spanish, and she doesn't speak Spanish. So we can do this in Portuguese, we can do this in Spanish, we can do this in Chinese or whatever language, and think of the barrier that will be removed as a result of that. So there's another opportunity there. Next slide, please. Yeah. Other things we've been doing, institution specific, topic specific chatbot. Think of taking all the information you have on lots of organization and healthcare organization have done this. Like you have a website where you've talked about maybe diabetes and all of that. You have resources that you've created. Now think of the possibility of putting all of those resources and training it with a topic specific chatbot or an institution like a chatbot for your hospital with restricted access such that it only takes information from your content, but now it's providing it as a chatbot and is available to patients. Those are some of the things we're doing with the menopause chatbot, where we are taking the information source that we have curated. We're also doing it with the breastfeeding chatbot that we're testing as well. So that is extremely, extremely possible right now. There's also opportunity for co-design, what we're calling citizen developers now, and I'm going to show you some of the AI tools, applications that we've built, and we can now co-design in real time with patients. So we can develop an app with patient right there. Before AI came, we built a chatbot in my lab during my postdoc. It took us about 6 months to build the prototype. With AI, I rebuilt the first version of the dashboard in less than 10 minutes. Less than 10 minutes something we did 6 months. So the speed, the time, and all of that makes it very possible. Okay, next slide, please. The time is almost up. And here is an application as well that builds with AI. This helps track mental health. It takes news headlines and it rates it. Before you choose to read it, you can see, and then it tracks your media diet and gives you, the lowdown of what you've been consuming, your media diet. Next slide, please. Set my time. Yeah, we're also building AI agents that simulate patient population. Here are three types of patients, and then you can see if a hospital decides to make a decision, you can see a possible outcome of how this patient will react to it. Next slide. I'm just going so fast because of my time. So here is a patient, for example, Alex. Alex has transportation barriers. We can see what will happen. How will Alex react to getting a flu shot 25 minutes away from where he lives? And you can simulate what Alex will do. So we're also building this simulation agent, um, which is possible with AI now. Next slide. Yeah. Challenges and possible solutions. Of course, the ChatGPT held the first study that evaluated it shows that there's a lot of under triaging. So next slide. Some of the challenges we've seen with using AI in patient care, over reliance at the developer level, which I think Dr. Jarrett would speak more about, the ethical concerns and possible solutions that we might start to consider, accountability and all. Next slide. I think that should be the last slide. Yeah. So just some reflection for us to consider how to better support our patient to use AI more. So thank you for listening.
Thank you so much for the great presentation. I think a reminder for all of us, and part of the discussion of this series of talks is for the need for clinicians to be involved in the development of these resources rather than just having those out there and not really understanding necessarily to the degree to which patients are utilizing them to help inform their care, but really I think being part of the solution and trying to lead the way with AI. So Dr. Fast, I will turn this over to you.
Thank you. If you'll allow me to share my screen.
Elena, could you let Dr. Fast share the screen, please? Or if not, if you could bring up his slides.
It says you're screen sharing right now.
Okay, good.
It did say that. It did. Now it's gone.
Okay. Okay, and if we can. Elaine, if you could just share the screen from there, please. Yeah, or either one of you. Thank you very much.
Technology is great when it works. Thank you for letting me share today. I'm just going to briefly give you a few examples of how I use AI currently in the office. Next slide. We're going to talk about open evidence. We're going to talk about ChatGPT. We're going to talk about creating handouts and talking with patients about AI. And as always, I didn't create this presentation with AI. I used my own blood, sweat, and tears, although it would have been easier to just create the entire presentation with AI. Next slide, please. Last fall, if those of you that are in family medicine, if you ever read Family Practice Management, they had a great article on how to ask better questions with AI. And I found it so fascinating that I called the lead author, Kevin Kindler, in Pittsburgh, and I talked with him for 30 minutes. And he was very passionate about the need for clinicians to continue to find new ways of using AI in practice. Next slide. And so I challenged myself after visiting with him to use open evidence more in practice. And for the physicians on the call, open evidence is free to anybody with an NPI number, and you can create a free account. And this is a generative AI machine that narrows its bandwidth of the things it looks at as good quality clinical evidence. And so one of the things that I've found, and I dislike sharing this publicly, but I don't know very much about a lot of things. You know, in family medicine, it's a very broad-based topic. I can go from heart failure to diabetes to sports medicine, and I realize more and more that my knowledge base, although is good, I have a lot of holes in my knowledge. And so this is an example. This is a screenshot from about a month ago when I was talking with a family in the nursing home, and they were considering whether or not they were going to refer their family member for aortic valve replacement. And they asked me a question that I just didn't know, what's the chance that my loved one is going to die after that? And so I think they ended up seeing the cardiothoracic surgeon or the valve team to determine inline or open valve. But I said, that's a great question. And I shared my screen with them, and we pulled up open evidence, and I typed in a question, and we reviewed the results together. And the thing that's so important about asking better questions with open evidence or any generative AI is to be very specific about what you're asking. And so I think what I've learned is I try and put a lot of patient level details. If I wanted to just read about valve replacement, you could pull up to date, for example. But if I want to narrow down the question to my specific patient, I put as much information about that specific patient in the question stem to direct the response to exactly my patient. Next slide. The other thing I've been really impressed with open evidence is how quickly they have new iterations of their product. This is an example of something that just came out maybe 4 weeks ago or 6 weeks ago. And I've just started using that, and I wanted to share that with you. Open Evidence is one of those apps that will allow you to record a conversation and generate a visit note in there. And the conversation that's recorded, the interesting part to me about AI is they have different workflows in there called dot flows. And so you can change the output of the algorithm based on certain rules. And the one I've starred here is called an after visit summary. And so if instead of the output being a clinical note, you can make the output from your conversation with the patient being an after visit summary, and that will tailor it to a patient facing form where it will give them instructions or follow-up visits or reminders of the clinician workflow. And so I've found that to be very powerful, because sometimes the patient that is in front of me, I would give them a canned response, but it's tailored for a different reading level than the patient can read. And so you could tailor it to even a different language or a different reading level or whatever you want. Advance, please. So in addition, where the arrow is, you can actually create your own dot flow and go into open evidence and tailor your own output based on what you need. And so the thing that I've found with open evidence is once you learn how to use it, in about a month, they'll add a new feature that you didn't think you needed, but you found out that you did. And so I've been really impressed with their product there. Next slide. The other way that I use AI currently is open evidence is just tailored to peer-reviewed journals and certain information that's within their walled garden. Many of the generative AI machines have a worldwide web of information, and the same is true for ChatGPT. And so it's great for website data or public-facing data. I had a patient just a few weeks ago that was having trouble filling their medications due to cost. And so it turns out when I put their medicines into ChatGPT, I asked it to give me a list of the medicine difference with cash prices. And so what you can do, my EMR will go ahead and tell me how much the patient's insurance will pay for their medicine, but I have no clue if that's actually cheaper than the cash price for this medicine. And so when you type that into ChatGPT, you can make it list what cash prices are. And so I've often been surprised, because medication tends to change in cost perspective from a week-to-week basis. I've been surprised that sometimes it's cheaper for the patient not to use their insurance, but to pay cash. But I don't know how to help the patient find that information out. And frankly, oftentimes I tell the patient, well, take your list of medicines and put it into Google AI or ChatGPT to tell you what prices are the best. And so I think that one way that patients can take control of their health is to use these tools to find the best price for them. Next slide. The third example, this is a slide I shared at KU in the fall with the family medicine. The third example where I've used generative AI is for patient handouts. I have a number of patient handouts for physical therapy, but I was missing a back exercise for the McGill Big Three exercises. And so in a matter of 5 or 10 minutes, I created, last fall, I created a patient handout with some figures on that. And so I imagine that I could type it out, but this saved me about an hour of editing on that. Next slide. And the other thing that I've been surprised at is I talk with patients about AI. And the more I talk with patients, even more than 6 months ago, the more I find that they're using it. Like the previous speaker already mentioned, many patients have already plugged their symptoms into AI. And I think that patients more than a few years ago, they want their original reports. They want their original radiology reports in their hand. They want their original lab reports. I think patients are probably uploading those to their own AI as a second opinion. I think it's important as clinicians that we remember that we always treat the patient, but the patient always has their own advocates. We think of the patient advocate as being a family member or a friend, but I think that in the future or even presently, we're going to find that their advocate is now an AI bot. And the final thing I'll leave with you is I believe that relationships matter. I think that patients trust their physician. Just this morning when I was in clinic, I had a patient come in, tell me that he had already plugged his lab results into AI and he had noticed an abnormality and he had AI explain it to him, but he wanted me to explain it to him, not because he didn't trust the AI, but because he trusted me. And I think that AI is just another tool in our toolbox in clinicians. And my biggest takeaway is that we need to use this tool and we need to find out how best we can use this tool. Next slide.
Awesome. Thank you very much for that, Dr. Fast. I appreciate it. It was a great discussion. And then last, Dr. Jarrett, if you could talk to us some about some of the ethics of how we're using AI and what that means for us now and then moving into the future.
Great, thank you. I'm ready whenever you are to pull up the slides. No worries. Okay, great. Thank you. I just wanted to also add to my bio that I have the distinct pleasure of also having an appointment at the School of Pharmacy at UMKC, and then also at the School of Medicine. So I really get to live in that intersection of research and community work and academia. So I've really enjoyed being in that space, especially around this topic. Next slide. So I bring this up not to go into a ton of detail. I actually feel like the presenters so far have brought up amazing examples. And it sounds like you already have had a session to really do kind of some deep dive into this. And I think also it seems like you're also going to be having more conversations as part of these series. But what I like to bring up as really putting all of these kind of out there is that we also have to remember that AI in medicine really is going on across the entire system. So this isn't just something in one area. It isn't contextual to a department. People are using it in administration and operations as well as in care delivery. So it's really important for us to sort of think about this holistically, especially if we're going to be creating policies and procedures and education. So really thinking about all of the staff that are going to be impacted, as well as the patients across various departments and levels of care across an entire healthcare system. And I think it's especially important here in the United States as we continue to embrace kind of emerging technology in medicine. Next slide. So I can't really talk about ethics without talking about risks. So we've actually talked about benefits quite a bit. I think as part of the session, I think we continue to see examples of those things as we continue to use the tools and just give ourselves enough time for practice. But we still see a lot of risks and a lot of harm that are really coming to the surface. We have fortunately been able to do a lot of research and building evidence in the field of AI in, I think, especially the last 10 years and even especially the last 5. But we see some kind of like common themes, and this is how we've kind of built a foundation to sort of understanding AI ethics. One of the things is sort of in that reproduction of errors and biases. So we can't, assume that all of those things that we've kind of brought into the space or decisions that we've made so far that we might classify as errors or mistakes, we can't assume that those are going to be all cleaned up and taken care of when we put an AI tool inside of that. We also have a lot of issues with patient safety and liability. So who's responsible for when things don't go right, when there is harm to patients? How do we kind of understand that risk? And right now we don't have a lot of regulation that's helping us through that. So each hospital system is kind of figuring that out on their own. We also have a lot of issues with lack of transparency, our inability to sort of look under the hood and explain how AI is making decisions. That's a pretty big risk. The more that we build algorithms, even as hospital systems build them in-house, we'll start to see some of this risk be mitigated, but we still continue to try to understand all of these pieces, and it's very challenging. We continue to have issues with data privacy and cybersecurity. The more that we bring technology into a space, the more risk that we have in this area. So we continue to bring more people to sort of understand the risk management, especially in that space. I think the last 4 are really, I think, a great sort of pinpoint to medicine generally. So one of the concerns that providers and I think patients sort of have is, are we going to be over reliant on these tools? Are we going to have a bias towards automation? Will that sort of impact our critical thinking, right? So all of these questions are really kind of out there. People are starting to have a lot of dialogue around, how do we ensure that we're still thinking about these things and we still have the expertise of a provider. We also have seen an increase in denial of service. I don't know if everyone knows that, especially in the United States, our health insurance and our payers are early adopters of AI, which has really impacted our denial and acceptance inside of all of the insurance market. We also have a big issue, especially with generative AI, around misinformation and manipulation. So really thinking about whether information is correct, whether we can trust it. And that really impacts the patient-provider relationship, right? So if we have sort of that erosion of trust, if the information isn't correct, how can we work through that? Next slide. And so really, like folks like myself that are working in AI ethics, we really kind of ask these questions when we think about emerging technology. It isn't just about AI. We've been having these sort of questions, especially in medicine, for any type of innovative technology that have come into the space. And it's really sort of like that, I would say, conundrum that we kind of have as part of our human nature of the possibility, right? Like, what can we do? And then have that really up against the ethics question of what ought we do, right? So how do we kind of ensure that we're having these questions and not just jumping into the excitement, of building something or turning something on, but how are we considering what we should do kind of in this situation? What are our values? Things like that. Next slide. And so we really look at this when we really think about, I'm not really sure why this slide is blue. It's very interesting. It's very blue. But when we think about sort of the ethical problem space for AI in healthcare, we sort of think about these 3 things. And it's a Venn diagram, so I'm very interested in how they intersect. But really thinking about that interpretability problem that I brought up before, that they're really difficult to interrogate. So, this is that black box, kind of consideration. Mirrored biases. So mirroring, those things that are already happening in this space can be really problematic. This is also how people refer to garbage in, garbage out, right? So if we don't have good information coming in, we won't have good information coming out. And then the idea of that diffused responsibility, that if AI is sort of acting as an external agent, it really runs the risk of sort of diffusing that responsibility away from operators. And that could be extremely risky, especially when you think about medical providers. Next slide. So a lot of folks in AI ethics and medicine, we are trying to combat a lot of these things. We're really trying to think about, the 4 clinical ethics principles as a foundation. Those are an oath that providers take. It's, I think, a pretty common shared expectation, not only from providers and the provider community and hospital staff, but also an expectation of patients and their caregivers. What we've also seen is that we're trying to figure out how to define these 6 that are kind of listed. These are 6 sort of terms that you typically see when you really look at responsible technology generally. These terms haven't necessarily been defined very contextually across different industries, but we're trying. And I think that we still have quite a ways to go just to really define these, especially in the context of medicine. What does it mean to be transparent? Is that a policy thing? Is it procedural? Is it shared decision making? Is it provider education? Like, how do we kind of define that and put it into practice? How do we ensure that we're looking at fairness and inclusion, especially if we didn't build an algorithm, but we bought an algorithm, right? So how do we kind of think about those things? So these are terms that are still really being worked out and defined, but I think they're very important, especially as we continue to build like kind of a scaffolding in this space moving forward. Next slide. So the last thing that I'll just talk about and then in the last couple of minutes is sort of this idea of trust. So we can't really think about sort of the ethical problem space. We can't think about how we sort of work through the dilemma of risk and benefit without sort of getting us to the space of building trust, right? So we have to be able to have these kinds of questions. We have to be able to go through these dilemmas and to have conversations on the other side. So then hopefully we can get to a space where people are sort of aligned and can figure out how we move forward. Because there's a lot of things with technology we can't walk back. We've already moved them forward, and we have to kind of figure out where we kind of stand with them and how we build trust with each other with these tools and then of the tools themselves. And I think we've been kind of in this space, especially, I think we sort of hit this sort of tipping point in society. And I think it's really important for us to think about this because healthcare isn't sort of a vacuum. And so I think it's important to really understand that there are things that happen in our history, that things are happening in our society, and those things will show up, especially if there are certain populations that don't trust the system, or even people working in the system that don't trust the system. So I think it's really important to sort of think about those things. And I think it's been even pivotal since the time period of sort of 2020 to 2022. Next slide. So some of the areas where we're really trying to build AI trust is sort of in this technical arm, so people are really starting to understand and play around with it, right? So we've kind of created this like technical sandbox in our society. So people are using it personally, professionally, and building sort of that technical acumen or that, sort of AI trust in a technical sense. We're also doing it socially. So really thinking about shared decision making. And then I think the last one is really thinking about how are we thinking about shared values, beliefs, and behaviors. We really can't have an ethics conversation or even really solve an ethical dilemma without really understanding sort of the underpins of our values and beliefs so we can really understand behavior moving forward. Next slide. I'm actually going to just say one thing about this because I think that we have to really understand this cultural trust to really start asking yourself these questions. Why do we even care about AI? Why are we even trying to fill the gap? Why are we excited? Is it a savior? Is it a threat? Does it hold promise for me, for the people I care about? I think these are things we need to be asking every time we're using a tool or putting in a prompt, to really understand, what you're trying to do here, because it'll also help you if you end up using that as a tool for a decision that you're making. Next slide. Yeah, so I also just want to say that I actually think that Dr. Fast said this really well, and really just ensuring that we're continuing to build trust for AI, inclusive of sort of building trust for medicine, right? We have to have those kinds of conversations. I loved what Dr. Fast said about, really bringing those conversations forward into conversations with your patients. Next slide. Actually, can we go to the next slide? And I'm going to end here just for the sake of time. So the last thing that I just want to put here, and this will be my last slide, is to just ensure that you're sort of taking these kind of questions home for yourself, and sort of being in this state of inquiry. We are in this time where there's little regulation. There's nobody really telling you necessarily how to use some of these tools unless your particular hospital system has their own internal regulations. But you're sort of in this space where you get to kind of try some of this stuff on. I think with that is just being in that inquiry of understanding why you want to use AI and why you might not want to use AI. So really continuing to think about the risks and think about the benefits. And then also, have those conversations. So I think both presenters did a really good job of outlining some actual things that you could use and why they're important, and then questions that you can start to ask. And then the last thing is, to really continue to ask yourself how these benefit the people that you serve, really kind of understanding if you're putting something into the space that's really going to help them, or if it might put them at risk or harm them. So I'm going to stop there so we make sure that there's enough time for questions.
Awesome.